To dive deeper into the products, I want us all to take a moment to review some of the key disclaimers. For general wellness and are intended to help maintain or encourage a healthy lifestyle. And secondly, note that the information that I'll be sharing today, or by LifeWave in general, is meant to be educational and informative, and is not a substitute for professional medical advice. I am not a medical expert, so I strongly consult with your physician or a qualified healthcare provider before you start any new healthcare regimen, health regimen, diet, or even your fitness program. So it's important for you to follow any health or medical advice you have received and not to delay seeking medical help if needed. And last but not least, please be aware that LifeWave reserves the right to change product prices or selection as necessary. Now, I think an important topic. Now let us look at the statistics. Around 20% of adults globally suffer from chronic pain. So chronic pain is a type of pain that lasts for 3 to 6 months or even longer. So it's not just a temporary discomfort for many, it becomes a part of their daily life. And about 7% of the general adult population in Malaysia experience persistent pain that significantly disrupts their day-to-day activities. And that translates to nearly 1 million people, with a staggering 82% saying that their pain interferes with basic tasks. Like basic tasks like walking, sleeping, or even concentrating at work. I know that we have some Singaporean brand partners here. That's why I included the statistics for Singapore as well. About 8.7% of adults in Singapore have reported living with chronic pain. And this number rises sharply with age. And women are especially affected, with about 10.9% of them experiencing chronic pain condition. Is any one of you part of this statistic? Type me in the chat. I hope not many of you are experiencing chronic pain. So what I'm trying to say is this number shows that there's a pressing need, not just for treatment, but it's not just about LifeWave products, and it's about, like I said, holistic. Today's session, I will be talking about understanding the scale of the issue regarding to pain and how we can help people or even yourself improve your quality of life. We understand. Let us take a look at the different types of pain, because not all pain is the same. Pain can vary in duration effectively. It's important to first identify what kind of pain you are experiencing. I want to talk about 6 common types. First one is acute pain. Acute pain is short-term pain that comes suddenly. Usually it can be from an injury, even surgery, or it can be illness related. So it usually feels sharp or intense, but fades when the wound heals. The second one is chronic pain. Chronic pain, as I mentioned from the very, very first slide, is usually long-lasting. It can last for at least 3 months or longer. This kind of pain usually continues beyond the normal healing time already. And you will have this type of pain if you have conditions like arthritis, back pain, or even endometriosis. This kind of pain, they're often dull, throbbing, or achy. It can also come and go. It's not persistent. It can also be on and off. The third one is, as the name suggests, it usually starts in one area and travels to another. For example, have you heard of sciatica? Sciatic pain, for example, if the pain starts in your lower back, if you're experiencing radiating pain, you can also feel that the pain shoots down the leg. And it often has this like burning or electrical sensation. Right? The fourth one is referred pain. Now, referred pain is a type of pain that is felt in a different area. A common example is, let's say, shoulder pain during a heart attack. some heart attack survivor, they explained that my first symptom was I felt the pain in my shoulder when the heart attack happened. The sensation can be misleading. The fifth one is nociceptive pain. This is usually caused by physical injury or tissue damage. For example, like a sprain in your foot, or a cut, even a broken bone. It feels sharp. It can be aching or throbbing, but it improves as the injury heals. Last but not least is neuropathic pain. This kind of pain results from nerve damage or nerve dysfunction, usually described as burning, tingling, or stabbing pain. I think some people also describe it as sometimes. This kind of pain is usually chronic and is very difficult to treat. Since when you feel pain, I'm gonna use acute pain in this scenario to explain pain. Let's say you feel the pain when you step on something sharp. What happens next? In simple terms, the injured spot or the wound will send a message through your nerves to your spinal cord. Then your spinal cord will quickly passes that message up to your brain. And then your brain will read the message and say, oh, ouch, that hurts. That's painful pain. And usually when you feel pain, people will say, oh, okay, I'm gonna, it's uncomfortable. So I'm gonna take some painkillers to stop feeling that pain. Usually, or slowing down, or masking messages to your brain. So your brain doesn't feel the pain as much. But once the painkillers wear off, you'll feel the pain again. Can you relate to that? I think most of us do. There are 3 key LifeWave patches that support natural drug-free pain relief. The first one is definitely IceWave, Aeon, and X39. Each of these patches plays an important role in helping the body manage pain, help reduce stress, and support recovery. But I wanna say something as another disclaimer. It is important to note that pain can be caused by many different factors. As you have already seen, there are different types of pain, right? While our patches usually work well for acute pain, results may vary, and underlying condition like arthritis, gout, or even some long-term diseases. So recovering from that can also take a much longer. We always recommend you to seek for professional medical advice. I know our patches can complement the pain management, or even it can be part of your wellness routine, substitute for medical treatment if a disease like or a condition like arthritis has already been developed. Just want to put it out there first. When it comes to helping someone or helping yourself manage pain effectively, especially with our patches, it's also important to follow a clear process. And these steps, which I'm going to share with you one by one, not only help identify the pain more accurately, but also ensure that we are applying the patches in a more effective way. Okay, let's go through the steps together. Now, the first step is to assess the pain. Okay, you can ask the person, are you feeling any pain right now? Also ask if they have taken any painkillers before that, because that can also influence how they respond, right? Because as I said, painkillers can only mask or slow down the message sending to your brain. Identify the pain location. Now you ask, where do you feel it the most? And you can ask them to describe the pain. I say, is it sharp? Is it dull? Is it throbbing? Like, tell me how does the pain feel? And you can also ask them to rate the pain on a scale of 1 to 10, with 10 being the most painful. Number 3, determine the duration. Ask them, has the pain just started, or has it been there for days, weeks, or longer, even months? So this can also help you to understand if it's an acute pain or chronic pain. 4th, check for physical signs. The affected area, for say any swelling, any redness, or anything unusual. Okay? If there's an open wound, of course we have to be careful with it lah. The number 5, we can start with IceWave. If you are not familiar with using IceWave patches. I can share it. I'm gonna start by telling you can start placing the brown patches because IceWave comes in pairs. It has a brown patch and a white patch. So you start placing the brown patch on or nearest to the most painful area. Of course, if there's an open, you don't patch the patch on the open wound, right? Just patch it maybe next to it. Patch the white one and slowly rotate the white patch clockwise to test the different locations. I'm gonna explain more about this one in the next two. So the goal of doing that is to find the spot that gives them the most pain relief. Number six, ask them to drink more water. Encourage them to drink maybe like at least a cup of plain water because hydration supports the effectiveness of the. Now, number seven, maybe after a few minutes, you need to reassess and ask the person, say, hey, do you think that the pain has reduced? So ask them to give you a rating again. Just now you rated your pain, let's say 7, but now what's the rate now? Has it gone down to, let's say, 4 or 3? So if it has, that means your method is working. Finally, if needed, you can enhance the pain relief by adding maybe another pair of, or you can combine the IceWave patches with Aeon and X39 for some added support or for additional relief. IceWave patches, our natural solution for pain relief. IceWave patches are designed to help you enjoy life better. They work by releasing the negative energy in the body and support your body's natural ability to feel better, to feel less pain, so that you can move more. You can, live life to the fullest, right? The key benefits of IceWave is definitely because it's for pain relief and it's fast acting pain relief. You can feel better with some pain relief medication. Chemicals, no medications are being used, and it's also non-transdermal. That means nothing goes into our body. It's only using your body's natural ability. Of course, we are using the patented phototherapy technology. That means using your own body's heat or energy to reduce pain naturally. With IceWave patch, you are not masking the pain, right? The message sent to your brain to stop the pain. You're actually supporting your body's natural ability to restore and rebalance. Okay. How to use IceWave? It's very confusing, right? This illustration, but I'm gonna teach you the simplest way to remember how to use. I know it's a bit tricky. Remember, you always patch the brown one to relieve the pain. A tip that I can share with you, you just remove half of the seal at the back of the patch, and then you just try clockwise. The first one, you can patch it on, let us say, 12 o'clock, at the back of the neck. Then if the pain doesn't, reduce even slightly, then you can move to, let's say, number 3 o'clock. So you continue doing that, and maybe every interval, let's say 30 seconds to like a minute, to find the best combination or the best spot for this pair of like IceWave. Let's say if you can find the best combination or the best location, the patches. This one doesn't confuse you. We talked about the effective patch IceWave. You must be wondering, hey, is this like for real? Like it is backed by science, and there are 13 clinical studies. If you are curious to know like what's the science behind it, you can definitely go and look at all those clinical studies, because there are too many for me to show to you. Definitely go to your back office to have a look. Let's get how this all works, something that we call mitochondria. You heard mitochondria, the powerhouse of the cell. In simple terms, it's like a generator of your cell, right? And they are like the tiny engines inside your cells that turn food you eat, for example, fats, carbohydrates, into energy. And this energy is stored in a molecule called ATP. Or this energy is what your body uses to do everything from talking, from walking, to even to thinking, right? To healing, or even when you breathe. Now here, is where IceWave comes in. IceWave sends signals to mitochondria, kind of like wake them up and help them produce even more energy, even more ATP. It needs to reduce pain naturally. Can you hear the music?
Our body is made up of trillions of cells. They all require energy to function. Within our cells, in the mitochondria. Here, food is converted into chemical energy called ATP. ATP is released by the mitochondria so cells can use it. Mitochondria consist of two membranes, from the cytosol, and an inner membrane surrounding the so-called matrix. The area between these membranes is called the intermembrane space. ATP is generated at the inner membrane of mitochondria by an efficient mechanism called oxidative phosphorylation, involving several membrane protein complexes. Nutrients provide high-energy electrons in the form of NADH, which are used by the protein complexes to pump protons from the matrix to the intermembrane space. This continuous pumping creates a proton gradient, where the positively charged protons are attracted to the more negative matrix. When the protons re-enter the matrix through the ATP synthase production of ATP.
I'm going to talk about Aeon, which is the next product, but I'm going to relate that to inflammation first. While not all pain is caused by inflammation, types of pain, especially from injury or like even chronic gut inflammation, which in turn activates the pain signals. I want us to all understand the connection because I want you to see that watches are often effective in managing pain. That's why I want to talk to you. There's a that proved that YH Aeon patches produces a relaxing effect of the placement. And the patches do this by making the work better. And I included some of the other findings of the clinical studies on how Aeon patches can be beneficial in pain relief and relaxation. The first one is Aeon patches can improve the function status of 7 organs as measured by this EIS system and supportive of an anti-aging claim. The second one is from Dr. Dean. He discovered that the results prove that there was a rebalancing of the autonomic nervous system, and the pain levels also revealed a consistent decrease. Examples in the next slide. They provided evidence that acupuncture point CV6, which is below your belly button, and C17 is, I think it's here, like on the chest or below your neck, the base of your neck. By YH Aeon patches has a physiological effect on the body of increasing parasympathetic activity of the autonomic nervous system. Okay, this is evidenced by the electrocardiogram. There are some, these are the medical infrared imaging extracted from the Dr. Dean's clinical studies. Just a little bit of the context. Blue and green colors represent lower temperatures, whereas the yellow, orange, and red represent higher temperatures. Okay, when a part of your body, say your shoulder, is inflamed, it can be due to, caused by pain, right? It can be caused by an injury. So definitely there's an increased blood flow to that area because your body is responding to that injury or even an infection. This blood flow or increased blood flow will elevate the temperature of that inflamed area. That's why it's usually inflamed when you have an injury, right? Because your body is trying to, heal that. As you can see from the first 2 sets of images, the first one is obviously a horse, and you can see the before and after pictures. So the before one, you see a lot more like red, orange, and yellow, right? And after patching, you can see those colors reduced. You can see the green and the blue comes back. Remember one of the previous clinical studies that says about the parasympathetic. That means it can also, for example, if your body lacks like heat circulation or heat distribution, after patching Aeon, it can also rebalance your body and thermal distribution. It's not only to reduce inflammation, it can also rebalance your body. The benefits of Aeon. I have two sets here, one for Malaysia and one for Singapore, but they're pretty similar for Aeon here. Now for the benefits, the product claims of Malaysia, there are three, remember. Promotes relaxation, reduce stiffness and stress, and it can support for Singapore, same thing, relax, and it can also reduce stress. But it doesn't say the inflammation response here, but it still can help you to relax and reduce stress in a way. If you have been using our products, I'm sure you're familiar with X39. Now, in 2018, which is our CEO and founder of LifeWave, he invented his best invention to date, which is the X39, right? Which is designed to help elevate the levels of GHA copper peptide in your body. And this GHA copper peptide is known to reset genes to a younger. All this is done in a completely non-invasive, safe, and cost-effective way. GHA copper peptide. It is a protein, a small protein that's naturally found in your body. It's made of 3 amino acids, or what we call a protein building blocks. So it has lysine, histidine, and lysine. Right? The Cu here stands for copper, which is bound to that peptide or the amino acid. So in simpler terms, the GHA copper peptide is like a signal in your body that tells your cells and renew themselves. Okay? It's often referred to as a youth molecule because it can help improve skin elasticity, wrinkles. I have also 2 sets of the product claims here, one for Malaysia, one for Singapore. For Malaysia first, I'm going to talk about Malaysia first. First, X39 patch can help with minor pain relief. It can also support the inflammation management. So this can also be beneficial in reducing swelling, promote some recovery. Another key benefit is that it can sleep, and it can also help enhance your mental clarity, or it can also support wound healing. And last but not least, it can improve your skin appearance. I'm going to talk more about X39 later. This is just to tell you about the product claims. For Singapore, I'm just going to keep it general. With the phototherapy technology, it will help stimulate the skin with a low level of lights, and it can help improve your energy flow, which can improve your strength. I mentioned about the X39 and Aeon, right? Now you can actually maximize the benefits of these 2 products for better synergistic effects. The first combo, this combo will be X39 and Aeon, right? You can the back of your neck during the day for up to 12 hours. And you can patch Aeon on the same spot at the back of your neck at night, or maybe before you go to sleep, up to 12 hours. Okay. I want to show you the analogy for this. So imagine there are people trapped in there. It's important for the firefighters to put out the fire first before the paramedics can, go and save the victims, just in case they have some burn injuries and such. So very similar. Stem cells are, or even, your body usually responds to, like I said, it usually responds to an injured area. Then stem cells, as we know, they are usually the cells to help repair and to heal. So that's why they are usually drawn to the infected or the inflamed area to heal those damaged tissues. The inflammation is not managed, that can kill the stem cell. It's going to be counterproductive to repair and to heal the inflammation, or reduce the inflammation, which is the Aeon, where X39 can also help support, the repair, right? The repair job. Hence, I would recommend this combo, if not on a daily basis. How do our patches work? Your body releases heat in the form of infrared light. In our patches, the patches trap this very particular wavelengths back through the skin. That's why our body name is called LifeWave. And this signals the body to produce health benefits unique to each of the patch. Step 1, you just have to apply the patch on a specific point on the body. Just now I showed you the IceWave, right? Then second one, activate. This patch or the patches will be activated by your body heat. and the patch will reflect the wavelengths of light in the form of infrared light. And last but not least, they will produce specific peptides in the body. Now I mentioned about having good to have a more holistic solution to manage pain and not only rely on our patches, right? So let's talk about food, because what we eat can actually affect how our body feels, or even your joints, right? Some foods contain natural compounds that may trigger inflammation in the body, which can lead to more joint pain, especially if you're already dealing with some discomfort. And here are some of the food that you can watch out for. Now, the first one are nuts, especially peanuts, because they contain compound like phytates and lectins that may interfere with nutrients like absorption and trigger inflammation in some people. Tomatoes and other nightshade vegetables, these kind of foods, they contain solanine, which can cause a reaction in some people who are sensitive to it. I'm not saying that these are not good for your health. Consult with your doctor. The third one would be tea. Surprising, right? Because tea which can make it harder for your body to absorb important minerals. The next one is refined carbs and sugary drinks. And these foods can spike your blood sugar and lead to inflammation, which isn't great for your joints. So if you know someone or yourself have been diagnosed with gout, I would say one of the top foods that the doctor would recommend you to cut out is definitely sugar. Because of this reason. Last but not least is processed meats. And these processed meats often and a type of compound called advanced glycation end products. And these compounds can usually contribute to inflammation. Your food choices will definitely help support healthier and happier joints. Now, I have another important aspect of pain management is of course addressing the inflammation from through our diet. And there are certain foods, inflammatory can also help to reduce some pain and improve your overall well-being. And I have listed some of the examples here. So the first one, berries. It can be blueberries, raspberries, because they are rich in antioxidant. And antioxidants are known to fight inflammation and to manage oxidative stress. Okay. The second one, turmeric is good for reducing inflammation because it contains curcumin. Next one, ginger helps reduce muscle pain and soreness if you take it at a moderate, if you take it moderately. Lemongrass is known for its calming and anti-inflammatory effects. Fatty fish, last but not least, fatty fish like salmon, mackerel, they are high in omega-3 fatty acids that also naturally reduce inflammation. So try to incorporate some of this food in. If you don't like any of this, you can definitely do and Google. I even put one of the links here for you to go and find out what other foods that you can incorporate into your diet. Anti-inflammatory foods, right, certain role in pain management, and this is also supported by multiple nutritional studies. 3 important minerals that contribute to reducing inflammation. The first one is potassium. Potassium is found in avocados, spinach, bananas also. This potassium helps regulate muscle contractions and nerve signals. And research has shown that higher potassium intake is linked to a lower risk of inflammatory condition like arthritis. Okay? And the next one is magnesium, also commonly found in bananas, like nuts as well, leafy greens like spinach. This magnesium is very important for relaxing your muscles and supporting nerve health. Okay? And studies have linked magnesium deficiency with migraines or even some chronic pain. And last but not least, copper. Copper can be found in dark chocolate, oysters, and leafy greens as well. And copper is good for maintaining your joints and even your connective tissues. So with proper amount, right amount, it also supports your body's natural anti-inflammatory response.